Patient depart discharge process. You have assessed your patient and determined that they are ready to be discharged home. The discharge process must be completed in eCare. To start the discharge depart process, click the Depart button on the toolbar. Select the pencil on the Medication Reconciliation bar to access the Med Reconciliation Discharge window. You want to review the medications to ensure that an accurate medication list is sent home with your patient. You must determine if there is a duplication or if a new prescription must be written. The medication reconciliation process at discharge involves 3 steps. Review the previous home medications, review the new inpatient orders for medication that should be continued after discharge, and add any new prescriptions required after discharge. To start, you must review the home medication section. This section includes the active prescriptions and active documented medications by history that do not have a corresponding inpatient order. Any medication that has an orange circle with a white star has not been reconciled and should be addressed prior to discharging your patient. You may select Continue after discharge, Create new prescription, or Do not continue after discharge. After your review of all medication sections, you determine which medications you want to discontinue, continue, or for which you must create a new prescription. You should always review the medication section to determine if there are corresponding inpatient orders that the system was not able to match to a documented medication by history. You should begin by reviewing any compliance comments that have been entered for your patient's medications. This icon will only be present when compliance information indicates a patient is not taking a medication as directed during this encounter. Hover over the compliance icon to read the compliance information that was entered for Nexium. After reviewing the compliance comments, you are now ready to begin reconciling medications. You have decided that your patient no longer requires Lipitor after discharge. Select Do not continue after discharge for the Lipitor active prescription. Select Continue after discharge for digoxin. You notice that there are duplicate medications for Nexium, a documented meds by history, and a prescription. Right-click on the Nexium Documented Meds by History and select Cancel/Discontinue to permanently remove the duplicate. Since the patient told you that they are not taking the Nexium prescription, you want to select Do Not Continue. You want your patient to continue taking Ambien as needed. Because your patient has no more refills for Ambien, she requested a new prescription for Ambien 10 milligrams. Select Create New Prescription for Ambien 10 milligrams. Notice the blue circle with the white X before Ambien. This is the missing details icon and indicates that the order details are not complete. Click the missing details icon to fill in the required ordered details. Dose and dispense are highlighted in the ordered details panel. Select a dose and the number of tabs you want to dispense. Notice the missing details icon no longer displays. To redisplay the entire medication reconciliation window, click the down arrow in the left corner of the details window. You want to add a new prescription for Cipro for your patient. Click the Add button in the upper left corner. Type CIP in the Find field and select Cipro 500 milligram oral tablet. Your patient needs 1 tablet taken every 12 hours for the next 10 days. Select the correct order sentence, click OK, and then select Done. You have now addressed all unreconciled medications. You note that there are 3 orders for Lasix. The documented med by history is canceled, the prescription is continued, and the inpatient medication is automatically discontinued. Inpatient medications default to do not continue. If you wish to discharge your patient with one of these inpatient medications, select the circle for Create New Prescription. If your patient is on a beta blocker or an anticoagulant, you must prescribe this medication or enter in order for reason not prescribed. Click on a non-narcotic prescription. To select the routing for these prescriptions, click the ellipsis in the mid-right section of the window. At the top of the window, select All Pending Non-Tamper-Proof Prescriptions. This action will send all non-narcotics electronically to the pharmacy you select. Select Pharmacy from the drop-down options. Select the correct pharmacy from the options and select OK. Note that the hospital outpatient pharmacy should be the default pharmacy. When printing narcotic prescriptions, you must select each prescription and the prescription printer. If you are printing all prescriptions, you must select All Pending Non-Tamper-Proof Prescriptions and the printer. Verify that printer displays in the Send To field and All Pending Non-Tamper-Proof Prescription radio button is selected in the Apply To section. In the Output Devices section, select the prescription printer. Click OK to send your prescriptions for Ambien and Cipro to the printer. Click Reconcile and Sign button. This slide will only display when you are sending prescriptions electronically. Pharmacy information is located above the prescriptions. You have reconciled your patient's medications. A complete list of these medications will be included on both the patient discharge summary and the clinical discharge summary documents automatically generated from the discharge process. If you do not complete this step, you will be notified of a paper chart deficiency in your Message Center inbox. This will require you to go to HIM to complete the deficiency after the patient has been discharged.